Hi, I'm Catherine Watson, caregiver life coach and the founder of Find Houston Senior Care. And I'm here to talk about something that I personally have had to deal with, and I know a lot of you out there are dealing with it now. And the situation is, we really don't know how long Mom is going to continue to live. She's got a lot of health issues, but nothing that's really going to be life-threatening. She's just got a lot of chronic issues like dementia and, for my mother-in-law, rheumatoid arthritis, other chronic conditions maybe that are causing her to need a lot of assistance or some assistance, but they're not going to kill her tomorrow. So we've got to make sure that the money lasts. We've got to stretch the dollars as much as we can to make sure that she has the best quality of care for the longest time possible. Wow, that's a tall order, isn't it? I'm going to tell you what I found out and what we have done. And my feeling is less is more. Okay, what do I mean by that? We want Mom to have the best care possible, okay, for the longest time period. We all know that going into a nursing home is just not the best care option. The care is not good. They don't have enough caregivers usually to service the patients, and people are often left on their own and really not cared for very well. So that's something we're trying really hard to avoid. So as long as Pat could stay somewhat independent, we allowed her to. And we brought in help as needed. Lots of different ways you can do this. And we started out with home care at home. I think that's a very good place to start. A few hours, a couple of times a week is not terribly expensive. And it gives someone the support without stripping all of their independence away from them. And that's important for the person as well. It also stretches the dollars a little bit further. But you have to keep an eye on it because, again, safety is a concern. You want Mom to be safe. You want her to be happy. You want her to have the best care possible for as long as possible, right? So at a certain point, we realized that was really not enough care for her. And it really came to a head when she fell and broke her pelvic bone. And that was the breaking point for us. We decided something had to be done. But what was that? Was it assisted living? She was having more memory issues, especially while she was in the hospital and the skilled nursing for her rehabilitation. Her memory was just really off the charts bad. And that's common when somebody goes into an institution like that. It often gets worse because they're in an unfamiliar environment. They don't really know what's going on with them. They may be given medications for pain that have an effect on their memory as well. So you've got to take all these things into consideration. So what we did was we really talked a lot every day to the physical therapists and the occupational therapists that were working directly with her. And we asked them, what do you think she can do? Going home wasn't an option because she lived in another state and she needed to be close to family. So we had two choices. We had independent living or we had assisted living. Now, assisted living costs quite a bit more than independent living. But I don't want to throw her into independent living if she can't handle it. The consensus from the therapist was that she probably could go into independent living. And that was great. So from a physical standpoint, she could go. But mentally, I was still worried. I was concerned. Would she take her medications on time? Would she remember to take her medications? Would she double up on them? All these things that were concerned to me. Then I found out that the independent living community had a home care company on site. And we could hire them in 15-minute increments. So we didn't have to pay for 3 or 4 hours a day like we did before. which was good because independent living obviously is costing more than her house did since her house was fully paid for. We rented out her house to give her an income stream. We used the independent living. It gave her transportation. It gave her all her meals were taken care of. My husband and I lived close by, so we could interact with her on a regular basis. And she could still live somewhat an independent life in her own apartment. It was the perfect solution. With the home care component added to it, someone could check twice a day and make sure she took her medications. Whew. Relief. And that lasted for a few years. And then things began to escalate. The memory got worse. She started having more falls. And it became evident and apparent that it was time for assisted living. So less is more. Start in steps. Bring in home care and maybe home help if you can get a doctor's order for that. And start with that. Then take a look at independent living. Take a look at assisted living. Decide what her needs really are. Does she need 24-hour around-the-clock care? Or does she need a little supplemental care during the day? Less is more. My name is Catherine Watson, and I'm a caregiver too. Glad to bring you some helpful tips.